What do you love about Contra Costa?
What I love about Contra Costa is how supportive of an environment I feel like I'm in, whether it's the attendings or the upper year residents, down to like the support staff, our nurses. I always feel like I know where to turn when I have a question, when I need help, when I need support, or even a shoulder to cry on. And that's been, an incredible thing to have through all of the ups and downs of residency.
I've really been enjoying the 2-week rotations because as soon as you start to feel maybe down or tired from a rotation, you're switching it up and starting something new.
I love how many different types of procedures we get to do here, and also the ultrasound training. Something that is really cool and special is if the emergency medicine doctor has a lumbar puncture or something in the ED and there isn't a resident there, they will message out about it so that someone can come do it. And I feel like I've gotten to do so many cool things, including thoras and paras and lumbar punctures and ultrasound-guided nerve blocks and intubations, and I can just walk down to the OR and talk to the anesthesiologists or the surgeons and scrub in, and getting to have sort of the run of our hospital with so many attendings who love to teach us, and that is the same in clinic and with our specialists that we can message and involve, just make me really grateful to be at this type of program.
My favorite thing, or one of my favorite things about Contra Costa, is the registrar model, where we work one-on-one with attendings on most of our inpatient rotations. So on medicine, on OB, on ICU, we're usually the only resident working with that attending or a team of attendings. And this means that you really get to kind of tailor the learning that you do to what you need to work on, what you're interested in, and also you get to develop really great relationships with those attendings. So it feels like not only do we get to be close with our co-residents, but that extends to the attending and other staff community as well.
One of my favorite things about Contra Costa is definitely my patients. I've been reflecting on that a lot this week about how my relationship with my patients is really special. One of my patients this week just got a new job, so switching insurance, and so we had our last visit together, and it was really emotional for both of us because he's been through a lot, and I've been able to be there for him through some tough health situations. And then also I can tell our relationship is really important because even when my patients go to see specialists to give advice when they go see the cardiologist, they always come back and ask me what I think, what do I think about the options that have been presented, and I could just tell that they really value my input on and help when they're making these big health decisions.
There are so many things I love about being at Contra Costa, and I wouldn't go back and change my choice in residency ever. I'm so grateful to be here. The two that I want to share that are my favorite is definitely the people. I think that my co-residents are some of the most incredible and inspiring people that I've ever met in my life. And I'm really grateful to both call them colleagues and also some of my best friends. So thank you all. And then I think the second thing I really love, which I don't think any of us has talked about yet, is living in the Bay Area is fantastic. I can't tell you how many fun things I've done even during intern year. I've been to Tahoe and Santa Cruz and Napa Valley and Mendocino and San Francisco, and we've gone out to First Fridays in Oakland. And I feel like living here really gives you the opportunity to live life outside of residency and experience a lot of new things, which I'm really, really grateful for.